We will leave time for questions. So our last speaker is my coacher, Dr. Mariana Correa. She's a dermatologist who did all the way from Brazil.
Brazil.
Good morning. It's a big pleasure to be here with you. And I would like to thank for the invitation for Alona and Dr. Per, beautiful friends here. And my first time in BTS, I'm from Brazil. My name is Mariana Correa. I would like to, sorry. My name is Mariana Correa. I'm from Brazil, and I have my own clinic in the capital, in Brasilia, with 20 people that help me there during all my job. And everybody knows that botulinum toxin is the most common first treatment that patients take for us. And if you did the best results with your patients, they would like to do another procedures with you. So, in my opinion, the botulinum toxin is not only about the techniques. What I press for my patients, the individuality, the patient wishes. I like to listen to my patients and to pray for the details, the naturalness, and they like to sculpt the eyebrows. So this is so important for me. And looking at this picture, we can see that we have different shapes of eyebrows. So we can see some different identities in the shapes of the eyebrows. So you can see about age, races, genders, personality, and state of mind, emotion. You can see if the patient look tired or sad or happy. So it's like our identity. So for me, the eyebrows, and I think for you too, it's so essential. And here in these pictures, I would like you to check, for example, in the fourth picture, in your opinion, does she look tired or sad? So we need to analyze our patient to do a great assessment in the eyebrow to identify what he wants to do and what's his demand. And here, I like to study a lot about eyebrows. And what inspired me, in my case, was my first case. I was 23 years old, and I feel my eyebrows were so tired. And I started to do my procedure with a colleague, and my eyebrows, they didn't arrive at the same thing that I want to do. So now I'm 40 years old, and my eyebrows for me are much more beautiful than when I was 23 years old. And I press for the great experience for the patients. It's not about only the injectors. So the consultation, in my opinion, comes first. I like to listen to the patient, her demands, what they like to do. So it's the most important for me to listen to the patient with calm, and it's so important for me to be humble with our patients. And I like to explain my technique to the patients. I like to share some before and afters, because it's so important for his enchantment. And I like to show some details too for the patient. And it's so important because for some doctors, botulinum toxin, no pain, but for many patients, they feel pain. So it's important good topical anesthesia, massage balls, ice, what you prefer. And I like to inject into pores. And here, about my technique of artistic eyebrows, we can check, for example, at the first picture, how we can change the shape of the eyebrows with different points in the forehead. And here, I like to check the shape of the eyebrow, checking with some points to open. The more demand of my patient, they said me, I want to have a lift in my eyebrow. And I like to follow up my patient's visit required for a post 15 or 13 days. Can you play the video, please? Thank you. And here, I like to do a great assessment for my patients, to analyze all the movement of the muscles, And what is his demand? What is her demand? I like the distance of 2 centimeters from the arch of the eyebrows. And I like to do like a microtox, like doctor said, in the lower forehead. In the upper forehead, I use more points. And here in the orbicularis, I use more points at the first, more units at the first point. And here are some results for my technique. Like the complaint of this patient, oh, I'm looking tired and sad. Is it possible to change with the botulinum toxin? And her demand was not about the wrinkles, but about her emotion. And desired outcome, the brow lift to improve her eye image and the natural result. And she is 40 years old. So some points in the area of the glabella, I found 5 units. And some muscles we need to not to inject to improve the lift of the eyebrow. And here the distance that I like to shape for my patients and to press for the symmetry that some patients, they have the asymmetry of the eyebrows. And here the first point of the auricularis to open the eyebrows, I like to use 4 units or 3, depends of the patient, because we need to press for the individualized treatments. And here, her before and after, doing the movement and without the movement. Her upper lid are opened, more open at the second. And we need to see the difference of the frontalis muscle. For example, the type 1, full wrinkles, and type 2, the V-shape, type 3, central. So we need to check all the movements of our patients. It's so important for us. And here I want to take count of about the anatomical variations, assessment and movement of the forehead. And the first one, this patient has a beautiful eyes, yeah, green eyes. And she told me, oh, I would like to maintain my movement. So I use some little points in the forehead, like a microtox to maintain the movement. And the second one, the Brazilian men, they like to, not to improve their eyebrows, they like the natural results. They like the same shape of the eyebrows. And they like to maintain the movement. So I improved in this patient his asymmetry, and he was so happy that he did a hair implant, a hair transplant, you can see in the picture. And here about patients in the older age, I like to have a great result with maintain the movement, and we have to pray about the ptosis. So it's important to have a good natural result and maintain the movement. So I prefer to use in older patients, postmenopausal woman, microtox, and I like to maintain the movement and to open the eyebrow. And here the second one, here is more identified that this patient, the demand. The first one, oh, I'm looking so angry. Can you change the shape of the eyebrow for me, Mariana? And I told, yes, I can change for you. It's what you prefer. And she told me, I prefer a romantic, a friendly eye shape, and the eyebrow shape too. And the second one, she told me, oh, I'm looking tired. Is it possible to open my eyebrows? And I told her, yes, I do a technique for a lifting effect. And here are some points that I like to mark for a natural result and to maintain the movement, because it's so important for my patients. Here, the importance of the glabella, not only for the wrinkles, but for prevent a flaccid upper eyelid. That is so important for me too. Maybe you can prevent a surgery in the future. And the orbicularis ocular muscle, it raises the eyelids and elevates the eyebrows. So it's important to check the movement and how the patient wants the shape of her eyebrow. And about the crow's feet, how do you treat? How do you prefer to treat? In my opinion, I prefer to use not a lot of botulinum toxin. I prefer microbotox. In this case, this is a patient that is 36 years old, so young, but she used to run a lot. And so in this case, I not use botulinum toxin. I use collagen biostimulator to get a good result in a lifting effect and the skin quality, because it's not about the CrossFit only, but always the sagging skin. And here, this patient of mine, she sent me her picture this week, and she told me, oh, look at my eyes are much more beautiful, and my face is much more thin, because my patients, they like a thin face and a lifting effect. And so she sent me this. Could you play the video, please? So the best part for me is to see my patients happy, not only about the wrinkles, but about his identity. Know all the theories, master all the techniques, but as you touch a human soul, be just another human soul. So I like to see my patients so happy and with another self-esteem. This is what touched my heart. Thank you so much.
Thank you so much.